to welcome everyone to tonight's Medicare 101, Understanding Medicare and the Choices You Need to Make by Advocate Healthcare. Sue Grossinger's marvelous. I'm Barbara Rosenberg with ElderWorks. I'm one of the care consultants. Please be aware that this presentation and the chat box is being recorded. Before we get started, I'd like to explain a little bit about what ElderWorks does. ElderWorks is a nonprofit organization that provides complimentary assistance to seniors and their families. We can help with senior living, home care, or referrals for other support services. If you need assistance or support or know of any seniors who need help, we would be happy to assist. If you require a CE credit for this webinar, please complete the evaluation we sent to you via email and return it to events@elderworks.org. And that's ELDERWERKS. And it's also in the chat box. I put that information in there. And remember that you must stay for the entire presentation for full CE credit. If you have any questions throughout the presentation, you may use the chat box or the Q&A and ask questions. And we're going to be answering those questions at the end. I think a lot of what you will be inquiring about will be answered throughout this presentation. So I'm going to turn it over to Sue Grossinger. Thank you, as always, for your support of ElderWorks and Jennifer Prowl and all of us.
You're welcome. Thank you, Barb. Thanks, Jennifer. It is great to be here. Thank you all for coming. I feel I'm used to speaking to people in person. This is Medicare 101, Understanding Medicare and the Choices That You Need to Make. So we're going to get started. I want to tell you briefly a little bit about myself. I am the Senior Services Coordinator at Advocate Good Shepherd Hospital. I have been at Good Shepherd for 19 years, but I've worked with seniors and their families and Medicare for 30. So I know a little bit about this. So I'm very glad to be here. It's very important. What I want you all to know before I start is this is a lot of information. And I don't want you to panic, and I don't want your heads to explode. I want you to just take this in, that this maybe can be the beginning of your journey trying to learn about Medicare as you either approach 65 or if you're over 65 and are working and you plan to retire. So I have many people that come and see these presentations several times. I know that there's the ElderWorks Senior Virtual Senior Fair in August, that there will be some Medicare presentations. I also continue to do these presentations on Advocate Aurora Health's website, which is advocatehealth.com/Medicare. I do it several times a month through Zoom right now. So there are many places that you can get this information. This is not something that in an hour or an hour and 15 minutes or an hour and a half, you will know in piece of cake, unless you have already been doing some investigation and listening to my presentation kind of puts things together for you. I am a SHIP counselor, which is the Senior Health Insurance Program. That is a federal program that provides funding to the states to train individuals like myself at organizations, and also other organizations may use volunteers. We are trained to help Medicare beneficiaries navigate Medicare, whether they're transitioning or having problems or whatever. So that's what we do, and I've been a SHIP counselor for 15 years. So let's get started. Welcome to Medicare, everybody. Here we are standing at the front of the Medicare maze going, huh? So you're turning 65, you're getting bombarded through email, mail, phone, from all these people, and you're like, time out, what's going on here? So it's really, I want you guys to be educated consumers so that you know whether you want to talk to anybody or not. So let's start with, what is Medicare? So Medicare is your federal government program. It is what offers your health insurance. It's for individuals that are 65 or older, or if you're under 65 and been declared disabled through the Social Security Administration, and the 25th month from your approval, you will become eligible for Medicare. Anybody with end-stage renal disease or ALS can automatically get Medicare. You have to be a US citizen or a permanent legal resident. You've been in the United States a minimum of 5 years before applying for Medicare. Medicare is managed by the Centers for Medicare and Medicaid Services. So if you hear the term CMS, that's Medicare. Your work history or your spouse's history affects Medicare Part A premiums, but not your eligibility. And a divorced spouse can apply for Medicare benefits on the work record of their former spouse, as long as you were married for 10 years. Social Security processes your application. They are the window or the starting point to Medicare. You apply through Social Security, and they do have a little bit of general information about the Medicare program. Other parts of Medicare that we're going to talk about, the other choices, are run by private insurance companies, but that have to follow rules that are set by Medicare. So there are 4 parts to Medicare. And then there's something called a Medicare supplement or Medigap, which actually, and we'll talk about that, is not part of Medicare, but goes along with original Medicare. Some people always ask, why are there 4 parts? Well, it's funded differently. So every part gets paid for through different revenues, different ways. So here's the 4 parts of Medicare. Whoops. I'm going to move my little thing out of here if I can. There we go. So the 4 parts entail Medicare Part A, that's your hospital insurance or inpatient hospital care at a hospital or at a skilled nursing facility. Part B is medical, and that basically is everything else. Your doctors, your outpatient services, ambulance, emergency room. A and B are provided by the federal government. Part B is not anything, some people think Part B is a supplement. A and B make up your primary health insurance through Medicare. And it just covers different parts of your health care. Part C we'll talk about, those are Medicare Advantage plans. And Part D is Medicare prescription drug coverage. So those 2 things, Part C, Medicare Advantage plans, and Part D are provided by private insurance companies that have a contract with Medicare. Medicare has allowed them to provide that Medicare benefit by contract, okay? So Part C and Part D did not come into existence until January 1st of 2006. So before 2006, there were no choices to make. Ever since we added the drug coverage and we added Medicare Advantage plans that are sold by private insurance companies, the only other insurance companies that sold anything was your Medigap or supplement. Otherwise, it was just Medicare, and then you could get a supplement. There was no drug coverage or Medicare Advantage plans before 2006. I love this graph. So, hey, by the way, if you have a camera, take a picture if there's any shot of this presentation that you like. Advocate has a great Medicare resource guide that is on our website at, again, advocatehealth.com/Medicare. It is an Advocate Medicare resource guide, and most of this information is in that resource guide. So this kind of helps us look at what are our choices. How do we decide how we want to get our coverage? So on the left side, we're looking at original Medicare, A and B, your hospital and your medical insurance. Those combined are your primary health care. Then you can get a separate prescription drug plan or Part D coverage through a private company, but it is a Medicare benefit. And then you would possibly, because Medicare doesn't pay 100% for everything, you can get a Medigap policy or a Medicare supplement from a private insurance company. Those are not part of Medicare, but they are standardized. And we'll go through that as we go through this presentation. That is the original way of getting your Medicare. Medicare pays your bill primary, Medicare A and B. You get a supplement to pick up any deductibles or coinsurance that A and B leave, and then you get a separate drug plan. Or your other choice is what's called Medicare Advantage. That is Part C. It is like an HMO or a PPO. It's a Medicare health plan that's in the form of an HMO or a PPO, but it combines your Part A, your Part B, and usually your D coverage. It's all in one insurance plan. When you do get a Medicare Advantage plan, Medicare's not paying your bills anymore. You have to have Medicare A and B to get a Medicare Advantage plan, because Medicare is actually paying that insurance company to insure you, kind of just like your employer does. Medicare supports you, just like when you work and get an employer group health plan, your employer supports you. So you have to have Medicare A and B to get a Medicare Advantage plan. But Medicare doesn't pay your bills. You don't show your Medicare card. You picked a Medicare health plan in the form of an HMO or a PPO, and that's what pays your medical bills, as well as picks up, provides you with drug coverage if you need drug coverage. If you join a Medicare Advantage plan, you cannot use or cannot be sold a Medicare supplement or a Medigap policy. Medigap or Medicare supplements only go with original Medicare when it's your primary insurance. So let's talk briefly a little bit about what Part A and B cover. So again,
I'm going to interrupt you.
Yeah.
Someone wanted to know what the website was. Did you just mention Advocate Aurora? Which one was it?
Yes, I'm sorry. It's www.advocatehealth.com/Medicare. And our resource guide is on that website.
Okay, I answered it for you.
Thank you. I'm sorry. Sometimes tell me to slow down. Okay. Part A coverage is hospital insurance. That's for inpatient hospital stays, inpatient skilled nursing stays, home health. Usually Part A covers the nursing part of home health care, and hospice. Part B is medical, physicians, outpatient services, some other parts of home health care, durable medical equipment, and other medical services such as the emergency room, an ambulance, lab tests, MRIs, diagnostic tests, your mammogram, any of that, any of those kinds of outpatient services is covered by Part B. So when I talked about A and B, they don't cover 100%. So here's some out-of-pockets that are how they are in 2020. The amounts can change every year, and they usually do. They might go up a little bit. So for a hospital inpatient stay under Part A, original Medicare, if you're in the hospital even for one day, as an inpatient, you'd have a $1,408 deductible. That's for days 1 through 60 in what's called a benefit period. So Part A is not calendar, it's benefit period. And it begins on the first day of an inpatient stay and ends when you have not been in the hospital and or a skilled nursing facility for more than 60 days. Okay, so for an example, I go in the hospital 3 days as an inpatient, and then I transfer to a skilled nursing facility for 7 days. And then I go home, and I'm out of the hospital for more than 60 days and the skilled nursing facility. Well, while I was in the hospital in the skilled nursing facility, I was using for hospital days 1 through 150, and for skilled nursing days 1 through 100 in a benefit period. Once I'm out of those for more than 60 days, it basically resets. I get a new set of hospital days, 1 through 150, and a new set of skilled nursing days, 1 through 100. So if you're an inpatient in the hospital, if you are in the hospital and then you go home for more than 60 days and you come back as an inpatient beyond that 60 days, you are in a new benefit period. You could have a new deductible. And then there are copay days, 61 to 90, and a higher one, 91 to 150, which we call lifetime reserve days. Lifetime reserve days do not regenerate. I want you to know the way our healthcare is going, very, very, very few people are ever in the hospital that long. So all costs for each day after lifetime reserve days. And what that means is if in a benefit period, you used up 150 days, I think in the 19 years I've been at Good Shepherd, maybe 10 people used up their lifetime reserve days because they went from the hospital to a skilled facility, back to the hospital. And that's one of the things we're trying to take care of in healthcare, is to prevent that readmission. So, you know, if you use up all your Medicare days, then in a skilled nursing facility, you'd have to pay 100%, or even if you went back to the hospital. Now, if you have a supplement, there is a benefit that will pay up to 365 days for Part A hospital days if all Medicare benefits are used up. Inpatient mental health care in a psychiatric hospital is limited to 190 days lifetime. Skilled nursing, again, $0. Medicare pays 100% for day 1 through 20 after a 3-day hospital stay. And then there's $176 a day copay, 21 through 100 in a benefit period. If you use up your 100 days in a benefit period and you have to continue to stay in a skilled nursing facility, you would have to pay privately. It would then be considered long-term care. And then we have home health care and 20% of Medicare approved amount for durable medical equipment. Part B is different. Part B has a monthly premium in 2020. The base is $144.60. If you have a higher income, there is a higher Part B premium. I will show you that in a minute. Social Security, basically, once you apply for Part B, will go back 2 years and evaluate your adjusted gross income and tell you what the exact amount is. And there's ways to appeal that, so don't worry. There is a yearly deductible for Part B. This year it's $198 yearly deductible. And then for Part B, there's a coinsurance. The coinsurance is 20%. So Part B is kind of like if you worked and had a PPO. Part B pays 80% of an approved amount. You're left with a 20% coinsurance. Preventative services under Part B has no copay. And then for outpatient mental health services, it's 20%. A long time ago, it used to be 50-50 for mental health. They then were able to pass a law and made it 80-20, just like medical. So you must have Part B if you want to purchase a Medigap policy, if you want to join a Medicare Advantage plan, and if your employer coverage requires it. So for example, if you work beyond 65, but you work for a company that has less than 20 employees, usually, and I want you to check with your employer, but usually Medicare has to be primary and your employer insurance would act as a secondary. So you would have to get both Medicare A and B. Part B in active employment. If you have coverage through an employer group health plan and you are actively working, then you may not have to get Part B. You will not have a penalty if you enroll in Part B once you lose your coverage or even during the time you have coverage if you are actively working and it is an employer group health plan. You may want to delay Part B if you have that employer creditable health coverage and you're working after 65. Because basically you're paying for B kind of for nothing. It's almost a duplication, especially if your insurance is 80%. Well, so is Part B. So Part B would usually not pay anything. It does not coordinate with Medicare unless it, you know, your employer group health plan doesn't cover something as well as Medicare. If you do not have coverage from active employment and you delay Part B, then you may get higher premiums. That's the penalty. You may have to pay for healthcare out of pocket because you may not be able to enroll until what we call in a general election period. And we'll talk about enrollment periods in a few minutes. This is something I have many people call me just to go through what is the policy, because they want to make sure that they don't make any mistakes. So when I talked about your Part B premium and your income, if you were to retire or turn 65 in 2020 and got Part B, Social Security has a nice little relationship with the IRS, and they would look at your 2018 adjusted gross income. If you are an individual and it is less than 87,000, then it's that base 144.60. If you're married filing jointly, then it has to be less than 174,000 for it to be that base. But as you can see, and I'm going to see if I can do my little, here we go. So as you can see here, the next category for an individual is 87 to 109 in income, then it's 202. And then besides paying a premium for your Part D plan, you would have an additional $12.20 that you would have to pay to Medicare. Then we start going up in income, and so does the premium. Same with married filing jointly. Take a picture of this. It is also on the Social Security website. More than 174 to 218 is 202. More than 218 to 272 is 289, and then same with the Part D additional. But what I want you to know is this gets adjusted every year. So if you retire in 2021, they're looking at 2019. If you retire in 2022, they're looking at 2020. And then also, there is an option and the ability to appeal the decision that Social Security has made, because they're looking at 2 years ago. And if you know, for example, this year in 2020, you are not making the same income, then you can appeal it by doing a life-changing event form and documentation. Send it into Social Security. I know many people that have done it because they've retired, and they can say, look, this money here is not here anymore. And then Social Security, actually, you send it into your local Social Security office, and they will adjust your Part B premium. So here's the form. It's on the Social Security website, which is ssa.gov. Make sure you put in gov. So it's either socialsecurity.gov or www.ssa.gov. This is an SSA 44. And if you say, I'm not making the same income I made 2 years ago, then you can go on the website, get the directions, get the form, and submit it to your local Social Security office. And everybody I know that's done it has been successful, even if it's not the base. But say you're 3 categories up and you say, I'm going to be only 1 category. Definitely do it. Every year, they're going to recalculate. Okay? So, let's see if I can put this up. There we go. So Medicare supplement or Medigap policies, those are sold by private insurance companies, but they are not part of Medicare. A Medigap plan has an open enrollment period that provides you with what we call guaranteed issue. It's a one-time 6-month window after you first get Part B. So if your Part B starts, let's say August 1st, you have 6 months to get a supplement or to switch your supplement, where they cannot ask you medical questions. They cannot do any pre-existing weight. You are guaranteed that they're going to write you a policy. And that is a one-time Medigap open enrollment period if you want to purchase a supplement with original Medicare. You can purchase or change a Medigap policy throughout the year, anytime. However, you may not get guaranteed issue, meaning they may have the right to ask you medical questions and decide whether they want to issue you a policy or plan or not. The premiums vary significantly by company. So these Medigap plans are standardized. Even though they're not part of Medicare, they are standardized by the federal government. But a plan G or a plan F or a plan N with one company may be completely different pricing from the others. They are standardized, as I said. Each separate plan has the same benefit, regardless of which company you get the policy from. And plans are accepted by medical providers who accept Medicare. So if Medicare pays, your provider accepts Medicare, then your supplement will pay. If you're in Florida and you decide, oh, I think I'm going to get my knee replaced while I'm in Florida, I don't know why you'd want to do that, but you could. Then if you have original Medicare, it will be accepted because it's a federal program. And then your supplement, no matter what the company, if Medicare pays, the supplement will pay. And plan cannot be canceled, nor can they charge a higher premium due to your health conditions or your claims filed over the years. They cannot drop you, but they can raise your rates because they can say, well, you know what, the older you get, the more you may cost. So most of the plans, all the plans in Illinois except for one are what we call age attained. Hang in there with me. Sometimes this gets, there we go. So this is the chart for, let's see if I can move myself over a little bit. There we go. This is the chart for Medicare supplements. On the side, do you see, let's go back and I'll get my little red thing for you. Oh, there we go. These benefits here are actually Medicare A and B out-of-pockets, what's left after Medicare pays. So we have a Part A coinsurance, we have a Part B coinsurance, that's at 20%. For some reason, Medicare doesn't pay for the first 3 pints of blood. The supplement will. Part A hospice coinsurance, skilled nursing facility, so the first 20 days, Medicare pays 100%, but after that, oops, sorry, there we go. After that, there's a $176 copay. Part A deductible, which was $1,408 this year. Part B deductible is $198 annual. There's excess charge, meaning if a doctor does not accept the contracted rate or what we call assignment, they can charge 15% over that rate. There are very, very few doctors that, I would say 99.9% of physicians around here accept assignment. Foreign travel, Medicare does not pay for foreign travel, but the supplement might pick that up. I'm gonna get rid of this. So a C, a D, and F, if you're eligible for the C or the F, will pick up 80% after $250 deductible. So for example, I had a client who went to Canada. She fell and broke her ankle. Her bill in Canada for her emergency room total was $1,100. She took that bill, she submitted it to her supplemental company, and they, after a $250 deductible, reimbursed her 80%. So what I want you to know here is that the plan C and F are not available to people who are born in 1955 or later, or became eligible for Medicare after January 1. The Congress passed a law to get rid of that because those are the only 2 plans that pick up the Part B deductible. So now there are no supplements if you want a G or an N or whatever. None of the supplements for people born 1955 or later will pick up that Part B deductible. They'll have to pay that little bit deductible and then their supplement will pay depending on it. So if you see here, wherever it says 100%, it picks up that benefit. F was something that picked up 100% coverage. You would never have a medical bill if Medicare paid. G is just like the F, but there's one out of pocket, and that is the Part B deductible. And then the others are very close. So the more a little bit out of pocket, the lower the premium. Even though there are people I work with that are eligible to get F, the G now is so much cheaper that it may not pay for them to actually get an F so that that Part B deductible is covered. That's something you have to decide. If you want original Medicare with a supplement, how much do you want to pay in that premium? And then most companies, that premium goes up a little bit every year. So what we talked about right now already, we talked about original Medicare, the difference between getting the two different choices you have between original Medicare and the Medicare Advantage and how those kind of looked. We talked about what A and B are, original Medicare A and B, and we talked about Medigap and also the Part B premium and how Social Security is going to calculate your Part B premium. If you've worked 40 quarter hours or 10 consecutive years, or your spouse has, you can get Part A free. So usually Part A does not have a premium if you've worked 10 consecutive years, or if you're going to claim your Social Security and Medicare on your spouse, they have to have worked those 40 quarter hours. How we doing? Okay, so I hope everybody is not totally confused. Hang in there. Remember, this is the beginning of your journey, all right, in understanding Medicare. So the next thing we're going to talk about is Part D, or prescription drug plans. Now, Part D, again, was not around till 2006. My mother, who passed away in 2002, she did not have drug coverage, and she was a diabetic and had other health issues, and she probably spent about $800 a month on her medications, along with her other health expenses. So it does, even though these plans do have some premiums, it is beneficial to have a Part D plan. Part D is offered by Medicare-approved private insurance companies. You have to have at least A and/or B to enroll in Part D. Coverage you can get for drug coverage is either through a standalone prescription drug plan. So if you have original Medicare with a supplement or Medigap, you would get a standalone prescription drug plan. Otherwise, if you get a Medicare Advantage plan and you want drug coverage, you can get drug coverage in that Medicare Advantage plan. You choose a Part D plan based on your needs. Do not listen to your neighbor, even your husband or wife, or your cousin or whoever. Their Part D plan and their drug coverage is their plan. It is not yours. It is based on cost, convenience, customer service. But when I help as a SHIP counselor, we help people transition to Medicare, and we help them sign up for drug coverage or Medicare Advantage. When I do that, I need to know what drugs they take, what pharmacies they want to go to, and then through the Medicare Plan Finder, I am able to use that tool, and it tells me of all 28 plans this year, what is the best plan for that person based on their prescriptions. So I'll have one spouse who's the cheap date, and I might have their spouse who's the expensive date. And they may not be, and usually they are not in the same plan. So don't say, oh, my neighbor's, my friend has this, I want this. No, you need to really check. And then every year we can also help you make sure every calendar year that plan is the best one for you. So there's 4 stages to Medicare Part D. Many of the plans have a deductible. Some plans, the generics are not subject to that deductible, but only brand and higher tiered drugs are. If there's no deductible, and the only plans I know that have no deductible usually have higher premiums. So if you don't have a deductible, you would start at the initial coverage period or stage 2. Once you reach that deductible, then the copay amount you pay is lower. That's the initial coverage period. So that is between your deductible and what we say is $4,020 of the retail cost of all your drugs. So in that initial coverage period, you may pay $0 for your tier 1 generic, or $3 for your tier 2, or $5, or $42, or $38, or $42 for your tier 3. In the initial coverage period, there usually is a set copay. Then you can get to, if you purchase a lot of drugs during the year, it's the retail price, the price you pay to the pharmacy plus what the plan pays for you, reaches that $4,020. You've hit the coverage gap or the donut hole. Everybody's heard about the dreaded donut hole. Prior to 2010, the donut hole was a true hole. You paid 100% of your drugs when you hit the donut hole. Over 9 years, by 2019, the donut hole was reduced, and now it's just a sliver. It's 25% for all your drugs. Once if you really have expensive drugs and you're in the donut hole, and if you pay out of pocket the $6,350, what you pay at the pharmacy, you've hit catastrophic. And believe it, unfortunately, there are people that reach that. Once you reach that, catastrophic, you only pay 5%. It is all based on the retail prices of your drugs and what you may pay out of pocket. So those are the 4 stages of Part D. I have people that they never, they're in the initial coverage period all year round because they have very inexpensive drugs. And many of the plans have a $0 copay for a tier 1 generic. So don't think that you may not get into the donut hole. Most people actually don't. So how does Part D work? Well, it's optional. However, if you don't sign up and you don't have creditable drug coverage through an active employer group health plan or the VA, you will have a penalty if you try to join later. Every plan has a drug formulary. It has a list of drugs that are covered by the plan, and Medicare kind of sets standards for all the different types of drugs that Part D will cover. Most plans have that tiered formulary. So tiering, tier 1, tier 2, tier 3, 4, and 5, is really how they set their prices. I have seen generics that are tier 4s because they may not be common, and so for whatever reason, they are tiered higher. You will have a monthly premium for your drug plan. It ranges, the premiums in Illinois range from $13.20 to $135.90 per month. Again, if you have a higher income, you may have to pay a little additional amount to Medicare. It doesn't go to the Part D company, insurance company, it goes to Medicare. Should you enroll in a Part D plan? Okay, I never tell anybody what to do, but I'm going to say yes. You can do whatever you want, but my reason is, when you have your employer health insurance, you had drug coverage in it, whether you used it or not. I know you have to pay a premium for this, but believe me, I have seen people that at 65, they were perfectly healthy, and a year later, they had $600 worth of medications, and they could not sign up for Part D during the year. So it is for what if. You don't know what's going to happen. So if you don't take any drugs, sign up for the plan that has the cheapest premium, just so you know if you need it, it's there. So if you do have creditable coverage and you have an employer group health plan, is it as good as Medicare's? Most are, but you got to make sure. There's no penalty if you have an employer group health plan and you're actively working and you don't sign up for Part D until you retire. Same with Part B. You can prove both to Social Security and to Medicare that you did not sign up for Part D because you were actively working and you had an employer plan. So you want to think about that. Sometimes people, when they're approaching 65 and they have an employer plan, want to kind of weigh. You have a life-changing event when you turn 65 and become eligible for Medicare. So some people, you know, which would be better? Which is going to be most cost-effective for me? Should I go to Medicare and drop my employer insurance, or should I stay on my employer insurance? So a lot of times if somebody's going to stay on their employer insurance, we tell them just sign up for Part A, it's free. And when you go to retire or you lose your coverage, you sign up for B, and then Medicare becomes your primary insurance. So you got to weigh all that. You got to weigh, you know, sometimes the medical part of Medicare is cheaper, but maybe the drug part isn't, and people will stay on their employer plan because of the drug coverage. It's really, and it can be vice versa. The healthcare coverage is cheaper with your employer, but the drug coverage is better with Medicare. So those are the things you have to look at. Without creditable coverage or actively working, you may incur a late enrollment penalty. And if you lose coverage or you retire and you go beyond 63 days in a row, then you're without coverage and you may get a penalty and not be able to enroll until the open enrollment, the annual enrollment period. Oops, sorry about that, wrong button. Okay, there we go. So what is the penalty? The penalty, for example, is, let's say somebody lost their coverage, didn't sign up for Part D, I don't need it, and 10 months later, they signed up. So the penalty is based on the national average premium plus 1 times 1% for every month you were without coverage. So if the national average premium is $32.74, it is this year, you'd multiply that by 1%. That's 33 cents, okay? Because you were uncovered for 10 months. Oh, I'm sorry. So 33 cents is your penalty, 32.74 times 1%. Then you take that 33 cents and you multiply it by the number of uncovered months. So right here, we're saying 10 uncovered months. So approximately, you're going to pay $3.30 a month tacked onto your monthly Part D premium for life. And the national average premium gets adjusted every year. So, you know, it could go down a little bit or it could go up. So your penalty could go down a little bit or it could go up. So just, this is something to be aware. Okay, so we talked about the drug coverage, all right, and how Part D works. Should I or should I not sign up for Part D? Should I, you know, if I don't take any drugs, you know what? It might be worth it, even though you don't take anything, just to sign up for the cheapest premium. So you have the coverage. And then if you do get something during the year, have to start taking a medication, during the annual enrollment period, you would check and see if the plan for next year with your new medication, what would be better. So now we're really going to confuse you, hopefully not. So we looked at original Medicare, a supplement, and a separate prescription drug plan. That was the left side of our graph. The one choice, well, there's more choices, but the one way you might want to get your Medicare. The other way on the right side of that graph was Medicare Advantage, or Part C, and we're going to talk about that. So Medicare Advantage, this is the, here, I'll move this over a little bit. So this was the right side of our graph. Part C is like an HMO or a PPO. It is the other way. I'm sorry, I do talk with my hands. It is the other way to get your Medicare benefits. Part C combines A, B, and if you want, usually Part D, all in one health insurance plan in the form of an HMO or a PPO. You cannot get a supplement with a Medicare Advantage plan. So I'm going to talk about what Medicare Advantage is, and then we're going to also talk about the difference. A lot of people say to me, well, what is the difference between why would somebody go with original Medicare and a supplement versus going to Medicare Advantage and vice versa? And we'll talk about that. So Medicare Advantage plan is an alternate way to receive your medical and hospital benefits, but it's from a private insurance company that's contracted with Medicare. So remember, Medicare is not paying your bills. This insurance company, this Medicare Advantage plan that you purchased, you signed up for, is going to be paying your bills. The structure of how it pays is different than how Medicare, original Medicare pays. They can offer extra benefits from Medicare, and then again, they set their own price structure. So for example, if it's an HMO or a PPO, there might be co-pays and co-insurance when you render healthcare services, where with original Medicare, you're paying for that supplement in that supplemental premium, so you may not have many medical bills if you had a bad year. Plan choices vary depending on which county you live in. So for example, in McHenry County, here in Illinois, we have 24 Medicare Advantage plans. In Lake County in Illinois, we have 17. In Cook County in Illinois, we have 46. Woohoo! So it depends on where you live and what county you live in. Medicare Advantage coverage and out-of-pocket costs vary from plan to plan. Just because one HMO pays something a certain way does not mean the other one does. Same with PPOs. All Medicare Advantage plans are required to set a maximum out-of-pocket for health-related services each year. If you're aware, if you have employer insurance, your employer insurance has a maximum out-of-pocket. I have an employer plan through my husband. I have a $5,000 maximum out-of-pocket. So after my deductible, I will be paying those 20% copays until I reach $5,000 out of pocket if I had a really bad year. And then I would reach 100% coverage. And I'll give you an example of how maximum out of pocket works and how quickly you can get to that. My brother was diagnosed with non-Hodgkin's lymphoma. He had a $5,000 maximum out of pocket from his employer plan. And in 4 months of treatment, he met it. So he paid those, co-pays or co-insurance. And then once he hit that maximum out of pocket, he did not owe any other medical bills. Medicare Advantage plans have star ratings. So if you're looking at one, you want to know CMS or Medicare does do surveys. How's their customer service? How's their coverage? How are things working? Are people happy with it? Supplement plans or Medigap, again, we have to keep reiterating this, do not work with Part C. And also, it's very important, if you're talking to insurance companies, supplements are not part drug coverage, and they are not Medicare Advantage plans. Supplements are Medigap plans that cover the out-of-pockets, depending on which one you purchase, after original Medicare pays. So what does Medicare Advantage cover? They include all the benefits of A and B. They do cover prescription drugs if you purchase one with drug coverage. For example, if somebody has their drug coverage only through the VA, they may want to get a Medicare Advantage plan if they're interested in that without drug coverage because their coverage is already. However, for example, my dad had VA for many years. And then as he got older, there were some medications VA wouldn't cover, so I signed him up for Part D. He was able to have both. So I had him covered both ways. Not the same drugs, but the drugs that VA wouldn't cover, we used as Part B plan. Medicare Advantage plans can have additional benefits. Medicare does not cover vision or dental or hearing. Medicare Advantage plans can offer dental, vision, hearing, and wellness programs. However, every Medicare Advantage plan covers those extra benefits differently. Some may cover more dental and more hearing or more wellness or vision than others. You also may have to use networks, network doctors and network hospitals. HMOs, there's no out-of-network coverage. There would if there's an emergency, it would be covered. But normally you have to stay in network or there's no coverage. PPOs have larger networks and there's in and out-of-network coverage. So we like to use the term pay as you go. So with Medicare Advantage, you may not even pay a premium for the Medicare Advantage plan. You may only have to pay that Part B premium to Social Security, to Medicare, or it gets taken out of your Social Security. And you may not have a premium for that Medicare Advantage plan, but you will have copays and coinsurance when healthcare services are rendered. The premiums for Medicare Advantage this year range from $0, there's a lot of them that don't have premiums, up to $166 a month. So this is kind of good. I like to look at this and say, let's compare the two. So original Medicare, you have to pay your Part B premium. It covers A and B benefits. You choose and pay a monthly premium for an individual Part D plan. Medicare, your federal government insurance, provides that coverage directly. You go in to see your doctor or hospital, you show them your Medicare card. Medicare pays your bills. Your choice of doctors and hospitals that participate in Medicare and accept new Medicare patients will accept you. You can go to any doctor as long as they have work with Medicare and they're accepting new Medicare patients. And generally, either you or if you get a Medigap plan will cover that deductible or coinsurance. That's the one date. So with a supplement, you are paying that premium. I like to say you're paying in advance because both ways you will have to pay your Part B premium. But if you do original Medicare with a supplement, you're paying that monthly premium for a supplement, not to pay later or very, very little. But you're paying whether you use it or not. Excuse me. With Medicare Advantage, you pay your Part B premium also. You have to have A and B. There can be additional Medicare premium, even though many of the plans do not have a premium. It covers your A and B benefits, but it also may include vision, dental, hearing. The Medicare Advantage plans are provided to you by private insurance companies, but they are a Medicare product. They are approved every year by Medicare. In most plans, you will need to use a network. If you go either with an HMO, there may not be coverage out of network. With a PPO, you just may have to pay a higher out-of-pocket cost. If you go out of network with an HMO, you may have to pay all cost. You will or may pay coinsurance or copays for services that are rendered. That's what we say, pay as you go. And Medicare supplements cannot work with Part C. So with Medicare Advantage, people may say, you know what, I don't want to pay for a supplement when I'm not using services. I would rather get a Medicare health plan, an HMO or a PPO. I know I have to pay my Part B premium, but otherwise I don't pay anything, maybe, if I get a zero premium plan, unless I use healthcare. And then I will have copays. What I want you to know, if you are working with someone about Medicare Advantage, do not just listen to them say, oh, you only pay $45 or $25 for your doctor. That is the tip of the iceberg if you use other services. You need to be able, as a SHIP counselor, I show my beneficiaries all the benefits that are in the Medicare Advantage plan. I will use their drug list. to find the plan, the Medicare Advantage plan. I will say, what do you want, an HMO or a PPO? I'll put in their drug list, and then all the HMOs will look at the plans that might cover the drugs the best, and also their providers will accept. Same with the PPO. So enrollment, I want to talk about that with you. There are 5 enrollment periods. There's an initial enrollment period, there's a general enrollment period, the annual enrollment period where us SHIP counselors are crazed, a special enrollment period, and Medicare Advantage has an enrollment period additionally, or it's enrollment or disenrollment period. Take a picture of this. If you, I think this is in that resource guide on Advocate, our website, which again is advocatehealth.com/Medicare. But this kind of talks about the different enrollment periods. So with Medicare, A and B, D and C, your initial enrollment into Medicare, whether you're turning 65 or you were disabled and it's your 25th month that you become eligible for Medicare, it's a 7-month window when you can sign up for Medicare. For any of, so you sign up for A and B, you get your Medicare number, then you can sign up for D, and or you can enroll in Part C if you want to get your Medicare that way. That is surrounding your 65th birthday. The general enrollment period is if you missed that initial enrollment period and you do not have an employer group health plan and actively working. That is not the general enrollment period. If you work beyond 65 and you have active insurance through an employer, that would entitle you to a special enrollment period when you retire or your coverage ends, whichever comes first. So general enrollment is for those people without coverage and they didn't sign up when they became eligible. That is one time a year, January 1 through March 31st. And yes, there are people that do this. Your Part B would not be effective till July 1st. If you're using in a general enrollment period and you sign up for A and B, and then you want to sign up for D, you would sign up between April and June, and it would be effective July 1st. Same with Part C. The Medicare annual enrollment period, that's for people already on Medicare. And so every year, the companies that sell Part D and Medicare Advantage sign new contracts with Medicare in September. And they let Medicare know what their plans are going to be for the next calendar year. So between October 15th and December 7th every year, I help people look at their drug coverage for the next calendar year. And if there's a better plan for them out there or they want to switch, we do that between October 15th and December 7th, and it's effective January 1st. I've been doing this Part D and Medicare for 15 years. So I have people come back every year. Medicare Advantage open enrollment. So if you're in a Medicare Advantage plan, you can switch during the annual enrollment period. You can go back to original Medicare, or you can switch to a different Medicare Advantage plan. But you also can switch either to another Medicare Advantage plan or return to original Medicare and enroll in Part D January 1 through March 31st of every year as well. You cannot do this if you are not in Medicare Advantage. Then there's special enrollment period, and that's dependent on you, and that you, for whatever reason, it's granted by Medicare in certain situations. And I know I get people calling me all the time, if I don't enroll in Medicare, even though I'm working and I'm on an employer plan, I'll get a penalty. If you are actively working, there are more than 20 employees in your company, check with your company though, you will not get a penalty when you go to enroll in B when you retire or your coverage ends, as long as your company fills out a particular form to prove, oh yes, Johnny worked for our company from this date, he's actually still working, he hasn't quite retired yet, he has an employer coverage, it started here, and that is still in place. That just tells Social Security, this is why I didn't enroll in B when I turned 65. I did not need it, and I had creditable coverage. When would I be automatically enrolled in Medicare? So if you're collecting Social Security prior to your 65th birthday, you would be automatically enrolled. You would get your Medicare card up to 3 months before your birthday month. It's the Part A and B card would be mailed to you 2 to 3 months in advance. Coverage automatically begins the first day of your 65th birthday month. If you're under 65 and you're disabled, benefits begin the 25th month after receiving your disability benefits. It's actually the 25th month from the date, I think, of that application, because they usually backdate. If you do not want to be enrolled in Part B, if you're automatically enrolled, say you're automatically enrolled, you're on Social Security, but you're on your spouse's employer plan and your spouse is still going to stay employed, then you would turn your card over, you'd sign the back, no, I do not want medical benefits, which is Part B, and they give you a return envelope and you mail it back into Medicare. They'd send you a new card that says Part A only, and it would be effective the first day of your birthday month. When are you not automatically enrolled? If you're not collecting Social Security, they don't know if you need Medicare. They do not enroll you. If you're still working and have an employer health plan that has more than 20 employees, if there's less than 20 employees, most likely, again, you will have to have Medicare primary. So you'll have to enroll in A and B, but that's a discussion with your employer if you have a small company. Those who have coverage through the health insurance marketplace, they are not automatically enrolled. So again, Social Security is your window. You can go on to ssa.gov and enroll into Medicare, either just A only, or you can enroll in both A and B. And I get a lot of calls and I help people, walk people through that application as well. If you're retired from the Railroad Retirement Board, you enroll through RRB or the Railroad Retirement Board, and you call them. You do not have to be retired to receive your Medicare benefits. I know many people, like I said, when you turn 65 and any time after, you have the ability at any time, if you decide, you know what, I want to switch off of my employer plan and go to Medicare as your primary insurance, you can do that. I'm going to move that out of there. So should I sign up for Medicare Part A and B? You can sign up for your Medicare benefit at age 65 and delay drawing on your Social Security till later. I have a lot of people that may get their Medicare at 65 or a part of it, and they're not going to get their Social Security till 66 and 2 months, because that's their full retirement age if you were born in 1955. Or they're going to wait till they're 70. That's a different question. But you can get Medicare and not get your Social Security benefits. You can delay Part B and D if you or your spouse are currently employed with creditable health insurance and you are on that plan. Here's the enrollment period, that initial enrollment period. It's 3 months prior to your birthday month and 3 months after. What I need you to be aware of, if you are retiring in your initial enrollment period and it's after your birthday month, you need to be aware of when your Medicare would start, because your initial enrollment period is kind of what trumps, I don't know why they use that word, but trumps your special enrollment. So I've had people, for example, that have said, oh, I'm going to retire, but it's 2 months after my birthday month. I'm still in my initial enrollment period. Well, if you look down here, let me get my little, where's my little, there it is. All right, let me show you. Down here, if you enroll in Medicare 1 to 3 months before you turn 65, it starts your birthday month. The month you reach 65, it starts the month after your birthday month. So if your birthday's in August, you retire before August 1, it starts August 1. If you enroll in August, it'll start September 1st. But if you are in your initial enrollment period and all of a sudden you have to retire or you do retire and it's the month after your birthday month, it doesn't start for 2 months. So if this was August is your birthday month and you decide that in September you want to retire and you want to get your Medicare and you want to enroll in September, it won't start for 2 months. That's November 1st. If you wait 2 or 3 months after the second month, it doesn't start for 3 months. And then the final month of your initial enrollment period, it wouldn't start for 3 months. So what I'll tell people, if you want to retire and you have the ability to plan and this is confusing, either we can help you figure out, okay, I'm gonna enroll in Medicare in September, which is the month after my birthday month, and I won't retire till October, so my benefit ends by November 1st and my Medicare will start November 1st. If that's too complicated, wait until your open enrollment is over. Your initial enrollment is over. So we have August, September, October, November. So as of December 1st for this fictional person, they are no longer in that initial enrollment period. They would have a special enrollment period to enroll in December and it would start January 1. Or you take a look at this kind of this graph here and you plan, well, if I retire in, say, if I enroll in September, I can retire in October, because if I enroll in September, my benefit will start 2 months later. It's a little tricky, and I've helped people do that, but it's possible. So just be very careful if you're going to be retiring in your initial enrollment period, but after your birthday month, there could be a delay in your coverage, is basically what I'm trying to say. And I got way too wordy on that, and I apologize. And see, I was talking so long, I froze. Hang on. There we go. I went too far. Okay. So, special enrollment period, again, like I said, you are granted it by Medicare in certain situations. If you have an employer group health plan coverage and it's based on your or your spouse's active employment, you can enroll in A and B anytime while you're still covered. And I'll show you the forms you need. They're on the Social Security website. And prove that you have employer group health coverage and you're working. Or if you retire, you have to enroll in B. For example, if you get a severance, you have to enroll in B within 8 months from when your coverage changed from a employer plan to retirement plan or severance. Be very careful about that. So by 8 months, if you go beyond 8 months from when your status as actively working changed to retirement, but they're covering you for a while, if you wait beyond 8 months to get your B, you'll be outside of that special enrollment period and in a little bit of trouble. Retiree and COBRA coverage are not considered active employment. That's the drug coverage in COBRA is creditable for Part D, but the medical is not. So make sure you talk to a SHIP counselor before you make some of these decisions. Oh, come on. There we go. So if you're signing up for Part B in a special enrollment period, you need these 2 forms. CMS 40B is the actual application for Part B. You have to already have A and a Medicare number. And then the CMS L564 is the request for employment information. And that's the form that you submit to Social Security after your employer completes it to say, hey, this is why I didn't enroll. I'm good to go. I don't get a penalty. I am eligible for a special enrollment period. Just recently, because of COVID, before COVID, you had to either walk these forms into Social Security or mail them in or fax them. Because of COVID, Social Security finally created an online application for Part B. That online application is actually these two forms on the website. You complete the forms, but then you will have to attach the L564 that your employer actually completed to prove that what you put on that form is actually true, and you know it's proof from the employer. So making changes to your coverage, we talked about, there's that Medicare annual enrollment period, October 15th to December 7th every year. You can join, switch, or drop Medicare Advantage or prescription drug. I want you to know supplements are not part of this this initial enrollment period, because supplements are not part of Medicare. You can switch your supplement whenever you want, as long as somebody wants you. And the reason I say that is you have that one-time part, supplemental open enrollment where it's guaranteed issue from when your Part B starts. Once you're beyond that 6 months, the companies have the right to medically underwrite you or ask you medical questions, and then they have the right to deny to write you a policy. There is a company in Illinois that never asks medical questions, but sometimes it can be a little bit higher. What happens is if you switch later, you may have a penalty, or not a penalty, I'm sorry. You may have to go through that medical underwriting, okay? And actually what happens is you just may have less choice. Medicare Advantage open enrollment period is that January 1 to March 31st we talked about, where you can either switch to a Medicare Advantage plan or you can go back to original Medicare. The special enrollment period, you can sign up for Part B because you worked and you had, an employer group health plan. And you can sign up for, Medicare B, get a drug plan, or get a Medicare Advantage plan. Special enrollment trial rights. The trial rights are for Medicare Advantage. So if you sign up for Medicare Advantage plan from when you're first eligible for Medicare at 65, you have a 12-month period to switch to original Medicare and get a supplement, and you will probably have guaranteed issue for that supplement. It's got to be in that first 12 months from when you first got your Medicare Advantage plan. If you say you got original Medicare and a supplement when you were 65 or 66 or 67, whenever you retired, say you go a couple of years and you go, you know what, I want to switch to a Medicare Advantage plan. If you drop a supplement to get a Medicare Advantage plan, you do have that 12-month trial period as well. So those are a couple of trial rights that you get with Medicare Advantage plan, and an opportunity to purchase a Medigap plan with guaranteed issue if it's in that first 12 months of trial. So there were some changes a little bit this year with Medicare. The Medicare Part B, premium increased to $144.60 a month. The deductible for Part B increased to $198. Part A premiums, deductibles, and coinsurance were also a little higher in 2020. The Medigap Plan C and F this year are no longer available to purchase by newly eligible Medicare beneficiaries as of January 1, 2020. The Medicare Plan Finder tool has been upgraded for the first time in a decade. The income brackets for high premium, what we call IRMA, the income-related Medicare adjustment, those brackets changed a little bit. Okay, it was last year, I think, for an individual, it might have been 85,000 and less for the base, and it was, I think, 172 and less. So they raised it a little bit before you had to pay a higher amount for your Part B. Medicare Advantage enrollment is increasing. It used to be, back in the day, it didn't start till 2006. It probably was up until a few years ago, about 19%. It's now about 30%. The reason is there are more PPOs, I think, that are available. There used to be a lot of HMOs And here in Illinois, people don't like HMOs as much. So there's more, and there's more baby boomers retiring. And they feel comfortable with these Medicare Advantage plans because they're used to the insurance. But it is increasing. But I think, you know, if there's only 33%, the rest are on original Medicare with a supplement. The Part D donut hole doesn't exist. Basically, it's now 25% of the full price of the drug. The maximum deductible for Part D, that went up to $435. And the threshold for reaching catastrophic coverage went up as well. So you're in the donut hole a little bit longer. In conclusion, I hope this wasn't too much information. I am a TMI person, I'm afraid. I want people to really understand what they're doing. It is helpful and makes things hopefully easier. So just remember, Medicare is your health insurance program. It does not cover all your healthcare costs. No matter which way you get your Medicare, you will have costs, whether you get a supplement and have to pay premium for that, or you get Medicare Advantage and pay as you go. But you have choices in how you get your coverage, and you can change. There are programs for people with limited income and resources. The decisions you make, that affects the type of coverage you get. And again, signing up for things, certain decisions are time sensitive, so be aware. And there is help. You can get it if you need it. Us SHIP counselors, guess what? We are free. You do not have to pay anything for us. I am at Advocate Good Shepherd Hospital. I do have a coworker, Sheila, and there are many other locations around, in every state even, there are SHIP programs. They might be called something else, like in Florida, they're called SHINE. I can't remember what it stands for, but SHIP is a federal program, so a lot of states have it. These are resources. Okay.
Sue,
yeah.
somebody asked, if all supplements have to give the same benefits, why would you go to a higher company?
Good question. So my answer is yes. Why would you pay more for the same product? And a lot of times what happens is, the differences can be, some companies may raise rates faster or more frequently, and other companies, you know, maybe they don't like their customer service, but the biggest complaint is people will purchase a supplement and then they may start getting increases more frequently than they expected. So when somebody is searching or shopping for a supplement, say you know you want a plan G and you're going to call different companies, you want to ask them, what are you going to charge me, and how often and for what reason will you raise my rates? There are many people that are loyal to certain companies and they're willing to pay a higher premium because they love that company. I'm not going to say the name, but many people are attached to certain companies. So the big issue is, you know, and it can't hurt to go with an independent broker to shop for a supplement. However, as a SHIP counselor, we have just been given a tool that we can look at pricing of the supplements. It is updated fairly frequently, but you would still have to call those companies to shop. But if a G or an F is a G or an F, no matter what, you just call those companies and say, what are you going to charge me? And try to make sure that they explain how they raise their rates and go from there. But that's a good question.
Couple more questions. What happens if you move to a different state?
For what? Just for...
What happens if you move to a different state with whatever Medicare Advantage you choose? I'm sure.
Medicare is a federal program. So if you have original Medicare, you don't have to worry about it. But a Part D plan, you call your Part D company and ask them what the benefit would be like in the state they're moving to in the new zip code. As a SHIP counselor, I get calls from people that I used to work with here that have moved all over the country. And I can help them choose their plans based on their zip code.
Okay.
So with Part D, you might have to switch. The supplement, if you think you're going to move at some time, I would talk to that either agent you're working with or the supplemental company. There are a couple companies that are so national, federal, like ARP and Aetna and a few others, Cigna maybe. Blue Cross Blue Shield is regional. So that might be an issue. You might have to re-enroll. And if here in Illinois, they are guaranteed issue. But if you move to another state and you need to switch to a Blue Cross of Arizona supplement, technically you don't have to switch, but I've heard that sometimes it might be difficult to get them to cooperate, that other of Illinois or whatever. So you want to talk to that supplemental company if you're going to purchase a supplement and ask them, if I want to move, what do I do? How does that work? The Medicare Advantage, yes, you have to switch.
Okay.
Based on the zip code and county.
Okay. A couple more questions. Someone wants to clarify, are you saying SHIP as in S-H-I-P or
Correct.
S-H-I-F-T?
No, it's S-H as in Harry, I, and then P as in Paul.
Okay.
And it stands for the Senior Health Insurance Program. And as you can see on this slide, it is a state. You can, if you live far away or you live somewhere else, you can call the state Senior Health Insurance Program or go on the website and you can put in your zip code, or you can find your county and where there are SHIP sites in your county.
Okay. Next question. If I'm 65 and no longer working and sign up for Medicare, may I also get Medicare coverage for my wife who was not working but 3 years younger and not eligible on her own?
She cannot get Medicare until she's 65.
Okay.
So I'm sorry to tell you, some retirees do have the ability to keep their spouse on their employer insurance until they turn 65 and then they're done. Sometimes it's a pension or something. I have people that walk in that are the gentleman was 74 and his wife finally turned 65, so he could retire. But she could not get Medicare unless she's disabled and been disabled for at least 25 months.
Okay.
But she has to wait till she's 65 to get Medicare. She would have to he'd have to see if there's something through his employer or his retiree benefit, or that he can keep her on even though he has retired, or gone on to Medicare. If he's still working and he goes on to Medicare, he might be able to keep her on his insurance. That is something he has to discuss with his employer.
Okay. And what are your thoughts on high deductibles for F or G?
Well, you got to be eligible for Medicare prior to January 1st to get a high deductible F, but there is a high deductible G now for those people. And you basically pay a very low premium, but you have to pay out of pocket, I think it's like $2,800 before that, that supplement pays. So at all. So, you know, it's up to you where you want to spend your money. That's what I tell people. Where do you want to spend your money? There's a plan N that has a little bit of out of pocket, and even a G with some companies. It could be $90.
Right.
It could be $70 or $80. So yeah, maybe with the high deductible G, you might pay 30 or 40. But it's all about, do you want to, you know, are you okay with paying that out of pocket until the supplement works? And basically what you're doing is you're saying, well, my supplement's not going to work unless I use a lot of healthcare.
If you move states, do you have to go through a medical underwriting with the same company? So
For
if
a
you
supplement, if you change, yes, you may. But some companies are national and you may not have to switch. So if the company does not have you switch, then you don't. But if you would have to switch, you might have to go through medical underwriting. That's why it's really important, if you're going to purchase a supplement or you're using an agent, you say, hey, I could be moving in a year or two to Tennessee or wherever I'm going. I need to know, I want that company. I want the company so that I may not have to switch, because if I get underwritten, I may get denied.
Mhm. Any other questions? One more popped up in the Q&A. Can you switch
Yes.
from high deductible without medical questions?
Not if it's a company that's like here in Illinois, the only company you could switch from high deductible to another would be Blue Cross Blue Shield. I think, that's a question for that insurance company. ARP, United Healthcare, there may be a period of time that they don't medically underwrite their people, but that is a question for that insurance company. There are insurance companies that they may say, well, we'll guarantee issue you an F, but if you want an N, you got to go through underwriting. So that can be really, that can be really specific to an insurance company. And it's very important if you're looking at certain plans and you think at a later date you might want to switch, you've got to ask that question.
Okay, great.
Hopefully they're going to tell you the truth.
Mhm. Mhm. Any other questions, anybody? Sue, do you want to just put your personal information into the chat real quick?
Sure.
If anybody has any questions, and I think people took a lot of photographs of slides and.
Good. Should I, there's the chat.
Yeah.
Okay, where is it? Why did it go back up? Hold on.
Next to participants, and that'll help.
Yeah.
And I just want to, while you're doing that, I want to
Well,
thank.
here.
Oh, there you are.
Here I am.
Okay.
So,
Perfect.
sue.grossinger@aah.org. Our senior services office, we are working remotely right now. We check our messages all the time. I work 7:30 to 4, Monday through Friday, but I will be heading back to the hospital August 3rd. And, you can call that office line, our senior services line. Again, if you want that resource guide, www.advocatehealth.com/Medicare. And you can download it.
In the chat, there's 2 I's in Grossinger, which is not the case. It's sue.grossinger, Grossinger, @aah.org.
Did I type wrong? Sorry.
Okay, just want to make sure everybody's got it straight because.
SUE.Grossinger, GROSSINGER @aah.org. Is there another question?
Any other questions? I'm seeing a Q&A. Can you fax forms or do they need originals?
For what forms? For?
Must be for Medicare. It must be for application for Medicare. Can you fax?
Well, you know what?
I wonder.
You got to do it online or in person, which, for A and B, everything is digital, electronic now, but you can apply if you're not comfortable. You can apply over the phone with Social Security, okay? If you, for example, if you need to send in the other forms to start your B during a special enrollment period, the form that shows you had coverage, yes. The L564, you can fax that in, or you can, because it does not have to be the original. If your employer emails it to you, you can download that onto your computer and attach it to the Part B application online on Social Security, or you can fax it into Social Security. What you want to do is you want to find your local Social Security office and get the fax number. Do not send it to the national line that is like the black hole. You want your local Social Security office to get your forms. I have had people, because of COVID, oh, good. Oh, yes, this person just applied online. She uploaded the 1095-C. You can also do that because that's proof that you had employer insurance. You can do it a bunch of different ways. You have to upload it though. You fill out that form and then you would attach that document. But I have had people before, they did not have the online application until 3 weeks ago. So I had people, because Social Security is closed to people in person, I had people that sent the forms, the Part B application and the L564 to Social Security after their employer filled out the L564, either return receipt requested, certified, and then what I recommend you do is sign up for my Social Security account on the Social Security website. Once you have a My Social Security account, when they receive your Part B application and they process it, it's going to pop up on that account. If you don't want to do that, I recommend people call about a week or so after they get the return receipt or they fax it in to make sure that Social Security received it and they've processed it. All the years I've been doing this, when Social Security offices are open, like Woodstock in Woodstock, Illinois, they have a drop box that you can put things in, but they're inside the lobby. So now that the lobbies are closed, you can't even drop it off. So, but once, I only had 2 people in all the years I've been doing this that at the drop box, it got lost. Otherwise, it's worked really well. But you want to make sure, however you send in those forms, unless you do it digitally online. Did you say send signature required? You could send it return receipt requested by mail to your local Social Security office. And then call that local office. If you go on the Social Security website and you look up office locations, they never used to post their local office phone number, but now because of COVID, they do. They are all working remotely as well. Some people are in the office, I think they rotate, but you want to make sure about a week after you know it's been received, that they have received it and it's being processed.
Okay, wonderful. Any other questions of anyone? Well, Sue, I think you had us at hello.
Sure, Jerry.
It was just wonderful.
Oh, thank you. Whoever said that, thank you very much. It's very nice.
Thank you. Gosh, thank you everyone for just all of your support. Sue, thank you for.
You're welcome. Thank you for having me. Thank you for listening to me blabber.
Absolutely. It's wonderful. Thank you for the wonderful program. Thank you all for attending. Again, if you need CE credit, please email your completed evaluation to events@elderworks, elderwerks.org, and we will send you your certificate. Have a wonderful evening, everyone. And let's just double check if there's any other last question. We just have some nice comments. We so appreciate everything, and we appreciate all of you. So have a great evening, everybody. Thank you.
Stay safe and well.
Thank you. Likewise.
Excellent. Okay, so there's 8 attendees. I think they're getting off. I'm going to go ahead and stop the recording. Should have done